Hi, my name's Chelsea and I'm one of the physiotherapists here at Joan Kerner Women's and Children's Hospital at Western Health. In this video, I will be discussing bladder care after birth. So after birth, you should expect your bladder to work normally. However, there are some women who may experience some changes to normal bladder function. It's important to be aware of any signs that your bladder might not be working correctly to avoid any ongoing bladder problems. When your bladder is working well, you should be able to feel when it's full. Normally, if you've been drinking enough fluid, you should feel an urge to go to the toilet every 2 to 4 hours. Your bladder should feel empty after going to the toilet. Your bladder shouldn't leak, either small or large amounts of urine, either on the way to the toilet or with a cough, sneeze or laugh. Your bladder should empty easily without pushing or straining, and you should have a steady, continuous flow of urine that doesn't present as a stop-start flow. There are lots of things that you can do to help look after your bladder after birth. The first thing is to stay hydrated, particularly when breastfeeding, aiming to drink 1.5 to 2 litres of fluid over the course of the day and spaced out. Drink mainly water and try to avoid excessive amounts of coffee, tea or sugary drinks and alcohol, which can irritate the bladder. Ensure that pain from any stitches or wounds is well managed and that swelling is controlled with ice packs. Make sure that you're also able to open your bowels regularly, as being constipated can also affect your bladder function. If you're finding that your urge to go to the toilet isn't quite the same as normal, make sure that you're still taking yourself to the toilet regularly every 2 to 4 hours. Relax your tummy muscles and pelvic floor when sitting on the toilet to empty, and you may also try leaning forward slightly. Sometimes urinating in the warm shower or turning on the tap can help to initiate the flow. If you're not feeling quite empty after passing urine, try some gentle pelvic tilts, rocking your pelvis forwards and backwards, or standing up and then sitting back down to see if more urine will come out. I'll demonstrate some of these strategies now. If you have recently had a baby and are feeling concerned that you are experiencing an urge to urinate but you're unable to, or you're drinking a lot of water and you're finding that you're only voiding really small amounts and you're getting a really strong lower abdominal pain, then please present to the emergency department so this can be further investigated to ensure that your bladder is emptying well. Thank you for listening to this video. If you have any questions about the content covered in this video, please contact the Women's Health Physiotherapy Department on 8345 1727.